Hello and thanks for tuning in. My name is Sebastian Potthoff and I'm a lecturer at Northumbria University in the UK. And today I will be speaking about a process evaluation which we have conducted in the context of a large international implementation study, where we have developed a Stakeholder Engagement Tailoring Model for implementing evidence-based practices. This was a team effort, so at this point I would like to acknowledge all of my co-authors. To start with some background, as you're all very much aware, translating research into practice can be a difficult and time-consuming process. The field of implementation science seeks to address this knowledge-to-practice gap by applying systematic tools and methods to accelerate the knowledge translation process. And within this literature, it has been acknowledged that implementation needs to involve active engagement of key stakeholders. Stakeholders are individuals, organizations, or communities that have a direct interest in the process and outcomes of the innovation we are trying to implement. However, what we see in research and practice is often less than optimal. We often see no engagement at all, or there might be a top-down approach to implementation, or minimal engagement via single methods, for instance, where stakeholders are surveyed to identify barriers and facilitators. However, none of the work reported to date is what we would refer to as comprehensive stakeholder engagement, where stakeholders are formally engaged in all of the stages of the implementation process. This is something we try to address in the European Horizon 2020 funded Implement All project, which involved 16 partners from 11 countries, including 2 lower middle income countries and Australia. The project aimed to develop a user-friendly tool for tailoring implementation strategies and to demonstrate the impact of the tool, which we called ITFITS, on the implementation of internet-based cognitive behavioral therapy, which is an evidence-based treatment for common mental health disorders where we know the implementation is still lacking behind. The ITFITS toolkit is an online platform used by local implementation teams who work through 4 modules to design a tailored implementation plan. In Module 1, implementers identify goals and barriers to implementation. In Module 2, they match those barriers to evidence-based implementation strategies. In Module 3, they design an implementation plan, and in Module 4, they apply and review that implementation plan with the option to continue, stop, or redesign. What's unique about the ITFITS toolkit is its comprehensive approach to stakeholder engagement. For example, in each of the modules of the toolkit, there is a core implementation team who comes up with some initial ideas. They then reach out to a range of internal and external stakeholders to verify and discuss those ideas. In the end, they prioritize and finalize those ideas before moving on to the next module. The toolkit also incorporates 6 core principles, including to be open, so being open to stakeholder feedback. Finally, it also includes a range of methods and tools that can be used to seek stakeholder feedback. For instance, there's an integrated survey platform to collect, for instance, ideas on barriers and facilitators. To evaluate the effectiveness of the ITFITS toolkit, we applied a stepped wedge trial design, which you can see depicted on the right. I'm not going to go into too much detail, but if you want to find out more, you can use the QR code at the top of the slide to go to the study protocol. The experimental condition was the use of the ITFITS toolkit, and always 2 trial sites would receive the ITFITS toolkit at a time. For a 6 months period, they would work with the ITFITS toolkit to tailor implementation strategies to support the implementation of ICBT service at their local site. During that 6 months period, they would also receive minimal support from the trial team. After that 6 months period, they would get to continue with the work with the ITFITS toolkit, but without any further support. The control condition was implementation as usual, so in the figure you can see this white period before they received the toolkit, which was basically their baseline, and they would simply implement ICBT services as they would usually do it. And this trial was conducted in 12 implementation sites, with the primary outcome measures being normalization, uptake, and implementation costs. Normalization was measured with the Normalization Process Theory Measurement tool, or the NOMAD. But what I really want to focus on in today's presentation is the qualitative process evaluation that we conducted. And that aimed to understand the use of the ITFITS toolkit and the mechanisms that shape the use of the toolkit. As part of the process evaluation, we conducted a total of 52 interviews with implementation core teams and key stakeholders. And these were follow-up interviews, so we would do interviews when implementers first received the ITFITS toolkit, and we would then follow them up towards the middle of the ITFITS toolkit use and later on once they've used it for quite some time. We also conducted observations, a total of 115 observations of minimal support activities, including introductory sessions, support calls, core team meetings, and follow-ups. For the data analysis, we applied a grounded theory approach, starting off with some initial coding, then some focused coding, and finally some theoretical coding, which led us to the substantive theory of stakeholder engagement. This was a very collaborative and interactive process with the whole team, involving analytical team discussions, writing of case-based and conceptual memos, and a lot of drawing of conceptual diagrams. So now I'm going to jump straight to the Stakeholder Engagement Tailoring Model, or the STEM model as we call it, because that's probably what you're most interested in hearing about. So in step 1 of the model, you identify and prioritize engagement objectives. So why are you actually planning to engage with these stakeholders? Is it to understand barriers and facilitators? Is it to enroll them in the intervention, or to simply do the intervention? In step 2, you map stakeholders using pre-identified criteria. So who would be the stakeholders that you would like to reach out to, and why? Is it because they have a high degree of influence, or because they are experts in the innovation you're trying to implement, or is it because they have quite a lot of capacity? Next, you choose an engagement approach, so the way that you're going to work with the stakeholders. That could simply be disseminating some information to them, assessing their views and opinions, or it could be a more collaborative approach. Next, you're going to define the qualities and logistics of the engagement approach. So is it going to be a very kind of structured approach to engaging them, or more informal? Are you going to have regular meetings? And who's going to be accountable for the different steps? Lastly, you review your engagement objectives, and again, these map onto your previously set engagement objectives. So instead of providing you with a large number of illustrative quotes, I decided to present you a couple of worked examples to show you how the STEM model would work in practice. And these examples are directly derived from the findings of our process evaluation. So in one of the implementation sites, the implementers were trying to improve professionals' experience of the ICBT service, because the problem that they were experiencing was that psychologists didn't really understand how to use the ICBT service, who the service was useful for, and how to navigate it. So the objective was to enroll them and getting them to do the ICBT service. So they chose, as I said, psychologists because of their expertise and their impact on the implementation process. In terms of the approach, they decided to do some co-design workshops to develop some educational materials that would directly address some of the questions that the psychologists had about the ICBT service. So it was a very collaborative approach, it was very prepared and structured, and they would have it on a regular basis. And the outcome of that was that there was increased buy-in and uptake of the service. So it helped with enrolling and doing. In the second side, implementers were trying to increase the support for the service, because they felt like there was no buy-in from mental health directors. So they were trying to enroll those directors who had a lot of influence and who also had a lot of trust with those people who were implementing the service. And the approach that they chose was to seek their advice and approve it. So it was kind of a consultation approach rather than collaborative. In terms of the qualities, those were monthly meetings and regular emails to ensure that everybody felt accountable and that there was a sufficient level of activity. And this improved the network of service deliverers. It helped them verify some of their ideas and it helped them to get to do the service. This brings me to the take-home messages. I hope that today I could convince you that tailoring implementation strategies to local determinants of practice needs to involve active engagement of a range of key stakeholders. However, what we see in the implementation science literature is usually one of three approaches. Either there is no engagement of stakeholders at all, there's a top-down approach to implementation, or there's minimal engagement via single methods, for instance, by engaging stakeholders in the identification of barriers and facilitators. Given this need, we have developed the STEM model as a comprehensive, generalizable, step-by-step approach to engaging stakeholders when tailoring implementation strategies. The STEM can be applied alongside existing implementation theories, frameworks, and models to improve the uptake of evidence-based practices. Thank you very much for listening. If you have any questions about my presentation, please feel free to send me an email, or if you would like to find out more about the Implement All study, please use the link below. Thank you.